Now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Dr. Ellerin, thanks for your time once again today. So the governor said phase 3 of reopening will begin in Massachusetts on Monday. It's a lot of indoor activities, gyms, museums, movie theaters, even those casinos. What are your thoughts about that, especially given what we've seen in other parts of the country?
Yeah, I think this is really good news, Ben. You know, Massachusetts has done extremely well. You know, I think the medical community and the community at large, staying at home, social distancing, wearing masks, that's what's kept this virus at bay. You know, so I think as we open indoor things, like we've already done restaurants, and now with museums and gyms, you know, there's going to be capacity limiting. So that's the key. And there's also going to be physical distancing within this. So I think those two things, we'll take it slow and hopefully we'll be in good shape.
If there was to be a resurgence of the virus, a spike, how quickly could we identify that, and how prepared are we for that in terms of our hospitals?
Yeah, Erica, so from the time that someone gets infected, it's often a couple of weeks before that person may be hospitalized, and then often a week or two after that if there's a negative outcome. So it's often weeks later before we'll know the effects of the phase 3 opening.
As an infectious disease doctor, given what we see what's going on in the rest of the country, we reported today 40 now states seeing their cases rise. It's essentially every state outside the Northeast. What's your biggest fear right now?
So let's see, that's a good question. I think my biggest fear right now is pandemic fatigue, right? Because, you know, the way this pandemic is going to end is either enough people get infected or a great vaccine comes out, or we just sort of forget about the virus. And obviously that third part, the virus hasn't really gone away. But if we start losing sight of the things that we've done that has worked, then, you know, the virus can be unforgiving. So we have to just continue to remember that the virus is here, and even as we open.
And now in the rest of the country where we have seen a spike, a lot of young people now getting the virus. So the CDC now expanding kind of the list of risk factors. It's not just older people, people with pre-existing conditions. Who else should be worried about this at this point?
Right. So I think what's important is that there's no question as we get older, the virus becomes more dangerous, but you can still be young, you know, 30s, 40s, 50s, and have underlying diabetes, obesity, chronic heart, lung disease. You're still at significant risk. So we have to remember the vulnerable population. I think the CDC wanted to really just overemphasize the fact that chronic conditions are relevant no matter what age.
All right, Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Dr. Ellerin, thanks for your time today. A lot of ground to cover still on this.
Thanks, Scott.
As we move forward, we'll see you soon.